Thank you guys for being here. The topic today is best friends, how animals bolster human health. And like everything else here at Aspen, we got the expert panel here because these are the ones that really know what's going on and can talk to us about this. Starting on my left, Sammy Ramsey. He's the founder and director of the Ramsey Research Foundation. He's a professor of entomology at Biofrontiers Institute of UC Boulder, University of Colorado Boulder here in Colorado. He's a bee guy. I guess that's the best way of saying it, right?
Yeah,
excellent. Excellent. Next to him, Val McKenzie. She's associate professor of ecology and evolutionary biology at UC Boulder. Symbiotic relationships between animals and microbiomes is her big thing here. So thank you very much. And then Neil Vora at the end. He's a policy fellow at the Conservation International, and he's an adjunct professor of internal medicine and infectious disease at Columbia University. So first and foremost, thank you guys for all being here. And one thing we all have is, not all of us, but we all have pets or know somebody that has pets, and pets are integral to our lives. Animals are more integral to our lives than we think they are, and they're proving to be more and more beneficial to us as well. And so just kind of starting off the whole thing, and Neil, I want to start with you because we were in a panel yesterday, and one of the things that came up was One Health. Explain One Health to us.
So One Health is a concept probably first developed in the early 2000s, though experts in infectious diseases have been practicing One Health for many, many years, centuries probably. And One Health is an approach to public health that aims to optimize health outcomes between animals, humans, and the environment. It recognizes the interlinkages between human health with that of the health of animals and health of the environment. And it's a very important concept 2.5 years. We need to use a One Health approach when addressing public health threats.
And one of the things when it comes to public health, and this has been a theme kind of throughout the last couple of days here, is nothing really happens without funding, and funding is a huge issue. And we're going to definitely drill down into animals, how they bolster human health, and look at the other side of that coin as well. But knowing that funding is so important, and Sammy, one of your big things is you talk about novel pathways for scientific funding, and basically using more emphasis on animal and human health for trying to get that funding. What are the barriers to funding, and how do we break through that?
So there are a number of barriers to funding that have become more and more problematic as we have a lot of research questions that we really want to answer, but it seems like the pot of money for that is either staying the same size or getting smaller. And unfortunately, that has encouraged individuals to behave unscrupulously. There are a number of researchers who have actually have been submitting grants for work that they've already conducted to get money to conduct work that they want to conduct. And it's just become a normal thing. We just talk about it all the time. But if you have a project that hasn't been done yet, it can be very difficult to compete with people who are putting forward a grant that has all the details of completed work already present in it. Something that I've really been hoping to see happen more frequently is to connect people with the science. If the pandemic has taught us anything, it's that when people think of science as a black box of just inputs, random things happen in the middle, and then outputs, they don't trust what comes out of it at the end. But when I wanted to fund a study of a parasite of honeybees that pretty much no one had heard about, the people who funded this project were beekeepers. Beekeepers raised more than $90,000 with the average donation being about $40. And it was remarkable to see how invested they became in the process. But in addition to that, then they wanted to know everything about it. They felt like stakeholders in this. And so I was being invited to speak to pretty much every beekeeping group in the country. I'm going to New Zealand right after this to speak to the New Zealand Beekeepers Association. That was also integral in donating to these projects. And I've realized that when you connect people to funding, not only is there a pot of money available to you that's typically not accessed, but there's also an interest and intrigue that bonds them to the process of science.
So that getting that funding done that way, it gives them a vested interest as well. And so not only will they pay more attention to it, but future funding might happen as well. Their friends, kind of word of mouth type marketing about the funding issues and what's happening, and kind of what we're talking about here, the issues that are going on with type situations like this, correct?
Precisely. And it instills a sense of trust when they know the individual who's working on this project, when they feel like they've been a part of it themselves, they have less reason to be untrusting of what they're seeing going on there.
And Val, we were talking yesterday, and this is one of the things kind of open up my mind of like, if I had thought about it, sat down, it would have made sense, but I'd never thought about it. But you were talking about microbiomes in animals. and how, we talk a lot about microbiomes in us and humans and how much attention we need to start paying to that because that drives essentially our whole health system. But animals have microbiomes and they're closer related to us than we think they are.
Absolutely. Thank you for bringing that up. Yeah, I study a lot of microbes from wild animals, and it is amazing what we're learning and how connected they are to their health. In one case, for our local boreal toads, which are here in Colorado, a native species that's declining from a pathogen, we've learned how to harness some of their protective microbes, one of their skin microbes, to build a probiotic treatment for them to help them fight the fungus that's harming them. And so, in some ways, I like to think we're a little bit ahead with probiotics in toads than sometimes with the humans, but it's not a race.
Does that translate over? Like learning about the microbiomes and how to treat them and how to get them corrected, essentially, or at least on the right path in animals, does that translate over to us?
Yes, definitely.
In what? That's okay. So, this is a
really
subject that
choked
chokes a lot of people up about. And Neil, one of the things that we frequently talk about is the ecology and the environment and how we know that we're encroaching on the environment and that is causing issues. Obviously, the pandemic's a great example of, a bad example of that in a great way of showing that, that encroachment it can cause a lot of issues. But moving forward, are we doing better in that area?
I think there are signs of hope. I'm cautiously optimistic about the state of the global environment. I think the next decade will be pivotal in terms of turning the tide on climate change and loss of biodiversity. But when I see what the next generation of people are doing and the general awareness about the state of the environment, it gives me a lot of hope. And just to drive home this point, though, the health of humans is inextricably linked to what is happening in nature. And I'm a human medicine doctor. I still see patients in a public tuberculosis clinic every week. But what I do not find us talking enough about in human health circles is how what is happening to nature is going to devastate us in the coming decades unless we do something now. And just diving in particular into biodiversity. So that is a term that refers to the variety of life on this planet. Nature needs biodiversity for it to thrive because part of nature is all the forms of life that we have on it. And sadly, we are in the midst of the 6th mass extinction. Now, before humans arrived on this planet a few 100,000 years ago, there had already been 5 mass extinctions in the past. And those were related to volcanic eruptions and asteroids hitting the Earth, wiping out the dinosaurs. But the current mass extinction is basically wholly due to human activities. As we clear forests, as we move animals around and introduce non-native species to ecosystems and other factors, we are driving a loss of biodiversity, and that loss of biodiversity will have massive impacts on human well-being. But I have not lost hope in our ability to turn that around.
And we certainly want to talk about how animals help bolster human health, but part of that you have to talk about how not having the animals can have a deleterious effect on our health. And we hear that. We hear that, not having that biodiversity, taking, basically ripping out part of the rainforest can cause issues. But what exactly can what can happen to us if we don't have that biodiversity? Why is it so important? And this is for any of you.
You want to start, Sammy?
Yeah.
The bee part of it is so fascinating.
So,
No, that's fine. That's fine, yeah.
So this is something that I don't think enough people fully grasp when we talk about some of the crises that we're having.
Because we hear the rhetoric, right? It's bad for us.
Yeah, but it's typically without specifics. We hear that it's bad for us, or we hear huge, gross over-exaggerations of what would occur. So there's a quote that I've heard very frequently given that if the honeybees were to die off, that human beings would die 2 or 3 years later. And it's attributed to Albert Einstein. Now,
Is it true?
no.
He didn't
so
say
not
that.
only is it not true, Albert Einstein was a physicist, not an entomologist, and so brother's got to stay in his lane. But then, in addition to that, the person who did say it, his last name was Einstein, but he was not the Albert Einstein, and he also was not an entomologist. So please check the things that you see on the internet. People have existed apart from honeybee contexts since the beginning of human civilization. And there are plenty of plants like corn and wheat and rice that can grow without the assistance of honeybees. But think about how much that would devastate the economy. Think about how much our eating habits would change. Everything on our plate would be pretty much one color, be yellow or brown. We would lose so much of the diversity in our diet, and we would lose the ability to feed the huge... we have gotten used to being able to get an avocado any time of year for an incredibly low price. That is because of our honeybees. We have gotten so used to this factory farming system where we can produce these huge volumes of food, and food security around the world would be threatened by the loss of these honeybees. So then, let's consider the fact that every single year, we have been losing between 32 and 48% of our honeybees every single year. To make up for that, we then split the colonies that are left over, and each time we do that, those colonies are weaker and weaker until we reach a critical mass where we cannot keep doing this. But we're not working on solving the actual set of problems that's resulting in that. We've just been kind of poking at some of the symptoms of it and trying to allow for people to still keep splitting. We have got to actually go to the root of it, and it's exactly what Neil was talking about, and how we've got, we're moving invasive species around the world, we're contributing to climate change, we have brought all kinds of diseases that these honeybees have never dealt with before, and because they are naive to them, they succumb to them quite quickly. We have to make substantial changes to the ways that we are living and the ways that we are funding research if we are going to allow for our honeybees to be healthy and for our native bees to be healthy. There are 4,400 species of bees that were native to North America before the honeybees were brought over on the Mayflower. And we're putting so much focus on one species of bee and ignoring that these 4,400 other bees have been declining for much longer than they have been. And a lot of it is because our honeybees aren't healthy. Because when they get these viruses and they visit plants, they spit these viruses into the nectar of the plants. And when native bees come behind them and feed from those same plants, they get these viruses as well. So what we do to help the honeybees will help the native bees too, but we have to make sure that our focus is expanded so that we're not looking through this tiny lens and missing everything else out there.
And in the media, we call this burying the lead because I did not know that honeybees came over on the Mayflower.
Yeah, right?
That's where they originally came
Yeah.
from?
Mm-hmm.
So they're not native to this
They
country?
are
or
not native to
continent.
this country.
Okay, and since then they've proliferated, but now they're having issues. Is that the same worldwide, or is it mostly here U.S.?
That is the same worldwide. So Asia is sort of the cradle of civilization for honeybees. They came out of Southeast Asia, and this is the reason why I'm constantly talking to people about the fact that we do a huge amount of research on honeybees in North America and in Europe. Why is that the case, considering there are 10 times more honeybee species in Southeast Asia than any other area of the world? The greatest biodiversity in honeybees is in SEA. And so when there are diseases that develop, new symbiotic organisms and parasites and creatures that are showing up, they almost always come from that region of the world. And when we choose to direct our attention to just one section of the world and not the place where the viruses are actually showing up, we're always on this treadmill of running as fast as we can and getting nowhere.
So we've talked about how, we know that can impact our health in a negative way if we don't have enough honey, the bees you were talking about, we're looking at seeing what's happening with the encroachment in the different environmental areas. But Neil, overall, and this is kind of the general question for the whole thing, how do animals actually bolster human health? It's kind of the overall question to this.
And to build on what Sammy is saying about the impacts of biodiversity, which includes animal diversity on human well-being, right? So Sammy was talking about how our food security depends on that. Beyond that, let's just look at medicines, right? I prescribe antibiotics every week, or antimicrobials. Between 1981 and 2010, the U.S. Food and Drug Administration approved around 110 new antimicrobials. And 75% of those antimicrobials came from nature. Mm-hmm. Or if you take another example, captopril, which I love snakes, they're my favorite animal. Captopril and related drugs, ACE inhibitors, are some of the most important medicines for controlling hypertension and for preventing kidney disease. And that medicine comes from snake venom, because snake venom has these amazing properties to cause vasodilation, so expansion of blood vessels, to drop blood pressure and kill the victim, some types of snake venoms, and right? And so the example I'm giving, though, is that this amazing medicine that we use comes from a South American viper, which I happen to have tattooed on my thigh. So
That's the other session. That's not this session. So.
Still bearing the lead, right?
And I'll give one more example, though, which is my area of expertise, which is infectious disease. You know, a lot of emerging infectious diseases originate from the tropics. And so that sometimes leads people to believe that biodiversity, including animal diversity, such as bats, lead to infectious diseases. But that is not true. Biodiversity in itself does not lead to infectious disease emergence. Rather, it is actions that lead to the loss of biodiversity, such as deforestation, that then lead to infectious disease emergence. Such as when we clear rainforests, we create these forest edges where people then interact with wildlife that has been displaced, whereas they did not have those opportunities before to do that. And in those interactions, wildlife pathogens can then jump species and infect humans. And so, again, the point here is that biodiversity, including animal diversity, is absolutely essential for our well-being. But when we destroy that biodiversity, we have negative ramifications for ourselves.
Yes, and if I could just
please.
add to that a bit, I love the whole thing about snake venom and the impacts that it can have, and how when we take the time to actually look at the ways that organisms have solved problems, well, it can be really effective for us. So we have not been on this planet for a long time. Like human beings, we are new to this world. And what diversity is simply new ways of solving problems. Every additional element of biodiversity is an organism that has found a way to exist in this very crowded world and solve a set of problems that has made it so effective at what it does that it can occupy a new niche. And so then we stand to benefit from that immensely. By finding out how they've solved a particular problem, we don't have to reinvent the wheel. We can use their solution to the same sorts of issues we're consistently facing. But when we lose those organisms, when we lose the biochemical pathways that they have already figured out, well, we either have to reinvent the wheel or that is entirely lost to us.
And there are potentially millions and millions of different therapeutics out there that we know nothing about. We're going to potentially discover over time, unless they're gone.
Precisely.
And if they're gone, we'll basically have to reinvent the wheel, like you mentioned. And Val, one of the things too is, kind of have to talk about this a little bit, is when it comes to bolstering our health, animal research is a big issue, as far as, getting research in animals first. And we talk about this often before it gets to human trials, it goes through animal trials of some type. And then, there have been a lot of changes in how those animal trials have been done and animal research has been done. And one of the new thinkings, at least I'm hoping it is, and it moves forward, is that, we are looking at helping animals to try and help us, but we are also looking at these, basically trying to figure out these different ways of making sure we help animals for the sake of helping animals, not necessarily to help us. Is that a new thought process, or is that?
Yeah, thank you for asking about that. Absolutely. I mean, we owe a lot to animals, especially given the damage we've done. We've got a lot of work to do to correct some of that damage. So everything from preserving their habitats, but then things we can do more directly, whether that's providing treatments for the diseases that are affecting them, captive assurance breeding colonies, things like that. And then like my probiotic work I was mentioning before that I do for boreal toads, there's a lot of work we need to do to improve the situation for animal health, for sure.
Helping them, though, getting that information, like you mentioned, the probiotics for the animals you're working with, the honeybees, making sure they come back, that in essence helps us down the line as well, too. Are there immediate results, or is this more long-term?
For the toads? Or
for any of them, yeah, any of these.
Because I think about the toads first.
Yeah, there you go.
But you knew that. Yeah, I mean, it's incredible what we've learned from animals and then how it indirectly feeds back to, oh, you know what, this might work for people as well.
And one of the big things we talked about is I did a story at Colorado State University at the veterinary center there, and they have a group of 5 golden retrievers that are siblings, and they ended up, I believe a couple of them ended up getting a bone cancer, and by treating them for bone cancer, it was the same type of bone cancer that children happen to get and they were able to kind of jumpstart that research and finding out how it worked well in these dogs to moving over to how it works well in children. And so I think that's, looking at the future of using animals to help us, at the same time turning that coin over and saying, how can we help animals, is going to be a big movement in that direction and a big help for both of us.
That's right. And for a lot of us that work on animals too, we all work with institutions at our universities, the IACUC. This is the Institutional Animal Care and Use Committee. And their job is to help ensure that any research that's happening on animals is safe, both for the researchers, but also for the animals. So it's usually a panel of veterinarians that are thinking about the animal care and what is this research, what impact does it have on those animals? Is this research necessary? Is it going to grow and advance our knowledge in ways that are meaningful? So a lot of us have to contend with a lot of those kinds of things if you work with vertebrate animals, not as much for bees, I assume. Lucky. But yeah.
Go ahead, Neil.
Well, just to build on your story about the golden retrievers, the mental health benefits of having animals in our lives, you can't even quantify that. I'm guessing a large proportion of the audience has pets, or at least everyone in the crowd probably likes animals a lot. Otherwise, you wouldn't be at this talk. But when you interact with your pets, there are so many endorphins released, and we feel so much better. The stress relief. That is why service animals are being used in hospital settings for people with chronic illnesses and terminal illnesses to help them in some of the most difficult moments of their life overcome or at least better cope with some of the challenges that they're facing. And so, the one other related point I would make to that is during COVID, at least myself, I was locked in a tiny apartment in New York City, but every moment I had to access nature and parks and see wildlife was just such an amazing release and did so much for my mental health. And so, again, that's just another example of the benefits that animals provide to us.
And if you want to see the perfect example of that, walk downtown New York City, the most hardened New Yorker just melts in front of a Pomeranian. It's amazingly impressive how much they do that. But Neil, kind of keeping on the same subjects here, is the system of nature broken right now as far as how we're treating it and how it's responding?
Yes. Right now, nature is in a very bad place. We talked already about the 6th mass extinction and climate change. Climate change is going to have devastating impacts on nature and ourselves. The greatest health threat that we face in the next century is climate change. And this is not only an issue for people in general, but it's also an issue of equity. The people least responsible for the destruction of nature are the ones who are most susceptible to the adverse effects because they don't have the resources to overcome the challenges that the destruction of nature poses. For example, I'm very privileged that I could, if my house were to be flooded because of a hurricane in New York City, I would probably be able to find the resources to fix the damage and to overcome that. But imagine being a person in South Asia where flooding is going to only increase in the coming years and not having the resources to be able to deal with those issues. And the other point related to this, though, is that the next decade is going to be critical for turning the tide on climate change and saving biodiversity. Right now, as we speak, there's a pivotal meeting happening in Kenya that will help set the agenda for saving biodiversity for the next decade. And it is critical that this framework be agreed upon, and within that, there's a move to save 30% of land and sea for nature, basically. And that 30 by 30 movement is going to be absolutely necessary if we want to do well for ourselves going forward.
And throwing this out to the three of you, we've talked about this in various sessions here, a lot of thoughts, a lot of theories on how to do these kind of things, but how realistic is that? Because, it's one thing for the researchers and the scientists to sit down and say, this is what we need. It's another thing for the politicians and the funding and the population to say, yeah, we want to move in that direction. Is that something you see the pendulum swinging that way, or is it still kind of on the other side of going, well, we just want to develop? Any of you?
I personally believe that what is realistic and what is doable is up to us. It is truly about what we are willing to consider reasonable and possible. There was a time, do you guys remember hearing about acid rain and how terrible the scourge of acid rain was going to be? And we actually figured out what acid rain was and what to do about it in ways that now would be so heavily bogged down in politics that we probably wouldn't get much done with it. And so we really do have to figure out how we are going to address these matters broadly in our populace, because what we decide to talk about in these meetings doesn't always get turned into policy. Most of the time it doesn't. It's easy to dismiss the people at these meetings as pie in the sky. Those are great thoughts, but the world doesn't work that way. I think we have to figure out how to disentangle this idea that politics is a toxic thing to attach to any of these subjects. It's going to have to become political in a number of ways if it's going to get done, and we have to figure out ways to have conversations with our politicians and elect politicians who will consider these sorts of things to be reasonable, because they will only be possible if we believe they are.
What could the average person do?
I'll take a stab at this. I think the greatest threat that we face to any of the successes in this domain, and I agree with everything that Sammy just said, but the greatest threat is disinformation. We have seen the spread of disinformation for decades now, and that is why there are still large segments of the US population, certainly US elected officials, who deny climate change, despite the wealth of evidence that climate change is happening because of human activities. Another example is wearing masks related to COVID or the adverse effects around vaccines. These are all issues that we could overcome had it not been for the spread of disinformation and misinformation. And so we need ways, I'm not an expert in this topic, but I think that is a fundamental issue that needs to be addressed. But once there is political will, I have so much confidence that changes can be done. I look at the example in Brazil from 2004 through 2012, where there was a 70% reduction in deforestation in the Brazilian Amazon over that 8-year period with an investment of $1 billion per year from the Brazilian government and the Norwegian government. So it took that political will, but they achieved these massive gains in saving rainforest without any decreases in agricultural productivity. And the difference now versus then in Brazil is political will. And so we need to elect officials that represent our views. And when I look again at the general US population, more than ever before, environmentalism is no longer a fringe left-wing issue. It is now a part of the mainstream discourse, and that gives me a lot of reason for hope.
I completely agree with Neil and Sammy. Thank you guys so much for these words. But when you ask about what can we do as individuals, there are things we can do as individuals, such as what you eat, what you consume, where you go, how you're using resources. Of course, there are individual changes you can make, but I don't like this perception that it all comes back to just our individual choices. It's not on all of us. We need that leadership. We need the policies to be in place to really change these issues. If we're going to meet some of these goals of 30 by 30, there's no way we're going to do that just based on individuals making their individual choices that are better. We need unified fronts, whole countries, whole governments, policies to back it up and get behind it. But I have mixed optimism. I want to be optimistic that we could do it. But I'm also realistic. But I do think enough people care about these issues. And it'll cause some change. But we see that there are ways to still live a modern, rich life without destroying the planet. There are ways to do it. We can get there.
I want to take questions from the audience if you guys have questions. Anne. Can we get a microphone? Or we'll get that real quick.
I've got some. I'm good.
One of my colleagues wanted me to ask about the golden retrievers and how they're doing, but I'm not.
They're doing great, actually. They're doing fantastic.
Good, glad to hear it.
And that was the most fun story I ever worked on, because I got to sit on the floor and play with 5 golden retrievers. It doesn't, talk about endorphins. Yeah. I was high for about a week.
Yeah.
And the microbes you're getting from them, so beneficial. We didn't talk about that yet, sorry. Yeah. I just have to quickly plug the microbes, because this was from the last session, if any of you guys were there. But the other benefit we get from our pets, not just the emotional benefits, the microbial benefits. They're sharing microbes with us in ways that are good, that are helping develop our immune systems and reduce the incidence of allergies, especially in kids. These are good things.
So my question was, environmental issues, we all care about them, but when voters go to the polls, they're not going to the polls on environmental issues. Economics is, the economy is always number one. I liked the idea of crowdsourcing, in essence, to fund research projects. I think we can't count on the federal government or any governments to keep sustained funding or to increase funding. So how do we make the economic case that this is the right thing to do? Because that's really what policymakers are going to care about. That's really what's going to move the scale for them. So how do we take some of these concepts and really kind of make an economic case so that we can get some of the funding and get the political impetus we need?
Sammy, this is.
I'll jump in on that one. That conversation is tough for me because it tends to reduce the conversation down to the exact financial impacts that it has on each person. And one of the reasons why we do that is because it works. If you keep things at a 30,000-foot view of the impact that something will have on the environment, the impact that it'll have ecologically, you can get some people to care about that. But if you want to get a critical mass of people to care about that, you tell them, if you lose the bees, I just need you to know, coffee and avocado toast out the window. What? Anytime I need to get millennials to be like, oh no, this is a problem, tell them that the avocado toast in Starbucks is over. So, yes, make it very personal. Now, there's a drawback to making it personal because anytime you can't conjure an exact financial reason why this organism or this study is important, people tend to be able to brush it off. But that is a big part of how you build that connection. The holy grail, to my mind, is being able to actually build that connection without making it entirely about money or the exact benefits that we'll receive. There was a study that I thought was absolutely fascinating, but it probably would have never gotten funded today. But it was, they massaged newborn hamsters to see if there was any benefit that the hamsters received. And they found that physical touch at that stage of development for these premature hamsters was really, really helpful for them. And now those same sorts of techniques are being used in neonatal care for premature babies, but at the time that they conducted this study, they had no idea what direction it would go in or what would be provided from it. And that's one of the toughest things about scientific funding these days is we have to still be able to fund studies where we don't know what the economic benefit is. We don't know what the answer is. But if you can, at the very least, explain to people why there are connections that are important, that can be an effective means.
And to build on that, and as you know very well, disinformation, again, is a major issue here because voters have been convinced, again, that climate change is not real or that renewable energy is bad for their stability of their energy source when that is not true, right? And so there needs to be ways to address that misinformation, disinformation. I don't have those answers. That's not my area. But again, I think that there's some of the ways that the population has been convinced of interventions that we need to do for nature. People have been convinced that they're not good for the economy, which is just not true.
Yeah, and if I could just add to that really quickly, a big reason why there's been such an amazingly effective push for all of this disinformation around climate change is because of what happened with the whole acid rain thing. When we found out that this was a result of polluters, we passed those costs on to them. They had to figure out how to fix it, or they were going to have to pay substantially more to continue releasing all this soot into the air because the remediation was going to be expensive. And because of that, they ended up losing a substantial amount of money until they figured out how to fix the problem, and they invested a lot of money into infrastructure that allowed for them to still have some of those same smokestacks, but actually purge some of the pollutants that were going into the air, kind of sucking it out of what was being released back. And after that, people began investing, these companies started investing huge amounts of money into op-eds and figuring out ways to control the ways that we think about the information around us such that that would never happen again. And it has been incredibly effective. And so we need to figure out how to counter that tide of misinformation, because it keeps good policies from going into action. It's kept the subject of climate change so heavily stifled for such a long period of time until people finally started seeing ridiculous amounts of crazy hurricanes that were destroying their livelihood until the point where we couldn't ignore it anymore.
Questions, ma'am?
Yeah, thank you. This question is for Dr. Sammy. I think between yesterday and today, the big idea, and then coming for this conversation, I see the importance of honeybees. So I'm curious to hear, what will it take to boost the research in Southeast Asia? Because obviously it's a critical, part of the entire ecosystem. But, are there any sort of capacity issues? The political will, what will it take to bolster research in Southeast Asia?
Thank you for asking that question, because I've been pondering that a lot myself. I've been working in Southeast Asia for the last 3-ish years. I mean, I guess we kind of have to ignore the pandemic section that we lost, but the work that was conducted there was crowdsourced. I went to other groups, other agencies to fund these projects, and I was told those issues aren't here yet. That parasite that you're talking about, it hasn't arrived yet. And I pointed to the fact that a similar, in Pakistan, they had the same parasite that I've been deeply concerned about. It arrived in their country. They lost the entirety of their honeybee population in just 3 years from this parasite that is currently expanding its geographic range, and we are investing no money, none, in studying this creature. And the perspective is, we will study it when it gets here. Right now, it's impacting developing economies. And so it's just not yet a concern. Well, those kinds of issues, I think something that's been very helpful for people is bringing it into their backyard. So when I remind them, we took a similar wait-and-see attitude to COVID-19, and how did that work out for us? That was fun, wasn't it? We have pollinator pandemics that have surfaced since then. The Vora destructor, this tiny 1.5 millimeter long little sesame seed looking blob, it is a terrible issue for our honeybees, and we had more than a decade's lead time to know that it was on its way, and we waited for it to get here. It became established and is now present in more than 98% of honeybee colonies in the US. And this parasite attaches itself to the bees, it liquefies their liver and sucks it out of their body. And so for that reason, our honeybees are dealing with a deficit in all the things that their liver does. The reasons why they're dying in such huge numbers when exposed to chemicals that they used to be able to deal with is because their liver is what detoxifies pesticides. So when we can bring it into their backyard and say, all right, this hasn't worked in the past, think about COVID, it does help people to kind of refocus and reframe, but I still have to figure out how to get this to the attention of big donors or other sustainable means of getting these projects funded. Because if we can get these research questions answered in Southeast Asia, if we can get a group of researchers, not just Americans, but if we can invest in the sorts of funds that allow for the people who live there to conduct this research. Do you know a big reason why a lot of researchers from Southeast Asia are not researching the organisms that they have right in their backyard? We have locked up all the data and information about these creatures in our journals. Our journals, for which there's a paywall of between $78 and $178 for them to access a single paper, when in Thailand, the Thai baht, their issue of currency, is 1/33 the US dollar. So their universities don't have the money to access a lot of these papers, and they would be starting from square one about a lot of these organisms. We need to change a lot of what it is that we are doing as a capitalistic society where we have monetized information, and yet the misinformation is freely available everywhere online. Can we monetize that? Can we make sure that people have to pay hundreds of dollars for misinformation and make real information free? What are we doing? Okay, I'm done. I'm sorry.
That was great.
But there's an important parallel here to build on your point about these pathogens spreading in other parts of the world and us as a society just waiting for them to hit North American bees on the human side as well. Some of you might have heard this, this claim that COVID is a once-in-a-century event. That is not true. In the past 104 years, we have had 5 other pandemics in addition to COVID, all 5 of those pandemics were the result of spillover of animal pathogens into people. COVID also was probably the result of spillover of an animal pathogen into people. And right now we have this unprecedented moment where at the highest levels of government, world leaders are talking about the need to reform global approaches to pandemics, which is absolutely vital. Right? So they want to invest more in vaccine development and better surveillance. I 100% back all of those proposals. But what they're not talking about is why pathogens increasingly are emerging in the human population. And the reason is because of the destruction of nature, what we are doing to rainforests, how we are treating wildlife, how we are raising farmed animals, and we are not talking about those upstream solutions that we know bring massive return on investment. We have a window of opportunity that will close soon, and we have to get this right now, because once that window closes, it's too late, and we're just going to be a sitting duck for the next pandemic. So we must invest in upstream prevention right now and not just wait for a pathogen to strike us and cause another pandemic.
And Val, you talked too about how humans' intervention can cause some issues in the animal world itself and cause big issues with that amphibian fungus. There was a human-introduced amphibian fungus.
That's right. Yeah, a lot of when we think about these emerging human pathogens, it's not just us who are experiencing these problems of emerging pathogens. Wildlife are too. We've heard certainly about the bees, but amphibians are experiencing these kinds of outbreaks. Every kind of animal on the planet are experiencing increased levels of emerging infectious diseases. And it's for some of the same reasons, because of globalization, because of the movement of animals to places where they didn't used to be. They're unintentionally also bringing over microbes and spilling over pathogens. We know how to stem that. We need to stop moving animals around the planet. We need to protect habitats and think about, do the way we do agriculture and farming and livestock a lot smarter than what we currently do. And just this no holds barred, let's just move everything around the planet and globalize everything. And no, we are spreading way too many really dangerous things, not just for ourselves, but also for biodiversity, which when that goes down, that's going to harm us too. So it really is back to the One Health concept. It really is all connected.
Could I ask a question too quickly?
You can ask as many questions.
No, just a really quick one. You mentioned earlier about how the microbiome of pets is actually really helpful for us. And I haven't quite thought of it that way. I've actually thought of it as the very opposite. So I took a parasitology class in college that freaked me out about. And so ever since then, when a dog tries to lick me in the mouth, I matrix out of the way. It's dramatic. And I've wondered, I see my friends, I see family members, their dogs getting all up in there. Well, they're alive. They seem fine. Am I missing something?
A little bit. It's okay. So probably, before you were grossed out, when you were younger, beforehand, that dog all up in your face was probably a really good thing for your health. Yeah, Rob Knight was in the panel previously. We were talking about this, about how, cats and dogs in our houses are really good for our immune systems. The microbes that they have, that they're sharing with us, help us develop our immune systems and can reduce the incidence of autoimmune diseases and allergies in particular. There's studies of people growing up on farms versus not. People exposed to farm animals at younger ages also have lower incidence of some of these autoimmune and allergy types of things.
It was interesting because I was going to talk about that, the fact that it reduces their chances of developing asthma, like you said, autoimmune diseases, to some extent, the food allergies out there, if they get exposed to certain foods.
Yeah.
Early in life, that's important, so having those pets in the house can be important for that movement and to have that. What I didn't realize is the microbiomes in the animals that is causing us, and just that interaction and playing with them. We always talk, one of the big things I always talk about is that it's good for your children to play in dirt because they can get the microbiomes from the dirt that can help build their immune system and
let the dogs lick your kids' faces, let your kids eat a little bit of dirt. But like we know from parasitology, there's some things that you don't want them to be doing, but generally getting exposed to dogs and dirt is really, really good for them.
And the other thing, when I talked about the Labrador, the golden retrievers, the one thing I did forget to mention is one of the reasons that they were able to make this jump and do the research the way they did it in the golden retrievers and basically look over at the human population that made it different from regular laboratory animal studies that they do is when they do laboratory animal studies, it tends to be in a very sterile environment with essentially lab-produced animals that are very sterile and only have one certain characteristic that they're looking at. But in this case, it wasn't just the nature of the animal, but it was the nurture too. It was the fact that these animals grow up in the same household as these children or as humans, so they're exposed to the same environments as human, and so they're able to make that leap and say, you know, it could be environmental, it could be genetic, it could be any combination, but the important thing is that we can figure out a treatment with these animals based on the same environment that humans are living in, and it seems to work. And so that's what we were talking about looking at that research in a different vein of let's do it in a more natural fashion. Mm-hmm. Any questions? She's bringing it to you.
I'm from Nebraska, so I would like to hear more about your ideas regarding smart farming. Like, what would that look like? Or what would need to change? And like, what would be incentivizing for that smart farming to happen?
That's such a great question.
And maybe you don't have the answer, but
yeah, let me take a stab at it. But I'm curious to hear what you guys have to say as well. Well, when we're using too many antibiotics on animals, we're unintentionally makes it a breeding ground for antibiotic resistance. So those bacteria are going to develop and evolve around those drugs, antibiotic resistance. And then those microbes can spill back over into humans, and then we end up with all these antibiotic resistant microbes that then we have to deal with in our healthcare systems. So reducing the use of or misuse of antibiotics in livestock is a really big issue. I think reduced density. So anytime you've got a huge density of animals packed on the landscape, that's just not good for their health. It's not good for the land, et cetera. So those are the big ones. And then, looking abroad, areas where there's been massive changes in how they're doing agriculture. One example is the emergence of Nipah virus. And this happened, about 20 years ago, I want to say. And in Malaysia, there had historically been mango orchards growing for some number of decades, and then pig farming also started to come into the landscape, and it was newer to that landscape. It hadn't been there before. And so you had these mango orchards interspersed with pig farms, and that was a new ecological association that didn't used to exist in that landscape. And the mango orchards bring in the bats. So the bats are feeding on the mangoes above the pig farms and releasing droppings into the pig farms. And sure enough, one of those viruses from the bats transferred and got into the pigs, started spreading, and then it also spread to humans. So that was a spillover, host switching, jumping event. And it was this pretty deadly virus that created an outbreak. So when we're thinking about how we're doing farming, we need to take the larger ecological context into mind and think about if you're introducing species that didn't used to interact before, what are you doing? What new situations are you creating for the emergence of pathogens?
And there's an additional dimension to the Nipah virus story from Malaysia in which there was also a component of deforestation. Mm-hmm. So forests had been cleared and these flying fox bats had been displaced. So when we clear forests, wildlife have to go someplace. And certain species that tend to survive deforestation also tend to be the same species that can be reservoirs for dangerous viruses. So in particular, I'm talking about bats. And I'm not trying to vilify bats. I love bats. Absolutely love them.
Do you have a bat tattoo?
I do, actually.
Yeah, see?
So we need bats as pollinators and also for pest control. But in terms of my area that I focus on in infection control and farming, additional measures that need to be done are thinking about vaccinating animals for vaccine-preventable diseases. When you do that, you can control diseases for which we have interventions for, and oftentimes those vaccine-preventable diseases look very similar to emerging infectious diseases, new ones. And so when you control the vaccine-preventable disease, you can more quickly identify the emerging infectious disease. And that way you can control it with outbreak response. Or another thing that needs to happen is participatory surveillance. We need to engage farmers and landholders as part of the stakeholder, as a stakeholder group in identifying emerging infectious diseases so that they have a stake in this, right? There is something for them to benefit in this, in that if they identify outbreaks quickly and they get support in controlling that outbreak, there's an incentive for them to report what's going on in their population. So there's a number of different infection control measures that can be implemented to reduce the risk of spillover.
Great. And unfortunately, we are out of time. So I appreciate it, but Sammy, Val, Neil, thank you very much. Great information.